Hi, I'm Dr. Erin Ducat, a sports chiropractor here at Ducat Chiropractic and Sports Medicine here in Bloomingdale. And today I'm going to show you a little bit about my approach for treating shoulder problems. So Melissa is our willing model today. And what we're going to primarily work on with her is some of the most common shoulder problem where the shoulder blade actually moves too much. And then you end up either getting impingement syndrome here or perhaps AC joint problems up in here because there's a lot of tightness here in the front. When that occurs, you're going to see it's really difficult for her to raise her arm up and overhead like this or out to the side. She'll have pain when she sleeps on this side, one of the most common presentations we see. So with this type of a problem, we know that we have to improve the way that her upper back and her neck moves. So we're going to start with a chiropractic adjustment to those two areas. So if you can go ahead and lay down your back here on the table. And so we're just going to start by getting some better movement through her spine. Joints never move in a vacuum. They all move together. So the neck, the upper back, the shoulder all have to be moving in concert for proper shoulder function. Next, I'm going to adjust her upper back or her thoracic spine as well. Place my hand here under her back. Take a breath. And out. I need one more here, a little lower. Take a breath. And out. Great. So now that we have the spine moving better, we're going to start working on that tight area here in front of her shoulder and then actually in the armpit area. So I'm going to come over here and we're going to take her arm up like this. I'm going to put some pressure here on her pectorals and we're going to stretch open those tight muscles. Now sometimes this can feel slightly uncomfortable because it is a deep stretch, but afterwards generally the joint's moving so well it's totally worth it. We can also repeat this process working on some of the muscles here, deep inside of the rotator cuff as well. There's other manipulations such as, kind of pressing down into the joint like this, rotating out. And depending on which area is tight on you, I'll pick one or more of these different types of adjustments. In addition, we can also use acupuncture into very specific areas here in the shoulder, and then sometimes points down here in the arm to help calm down pain in the shoulder. All right, so go ahead and sit back up. Now, Melissa isn't having active shoulder pain right now, but she does have a lot of tightness in this area. So we're just going to kind of do a post-test here to see how free things are moving, and she's actually moving much better after that short little treatment. So it's really important when you see a chiropractor or any type of other sports medicine specialist to make sure they fully assess the reason why you're having shoulder pain, not just use a cookie cutter model that may or may not work well for you. If you're local here to the Bloomingdale area, we'd love to help you. Check out our website at ducatchiropractic.com. So that's DUCAT chiropractic.com, and we'd be glad to assist.